Okay, now you guys, we're going to talk about the change of hormones during pregnancy. This is very fascinating. So human chorionic gonadotropin is one of the first signs of pregnancy. It's secreted by the trophoblast early in pregnancy, and then it helps stimulate progesterone and estrogen to be released by the corpus luteum. And we remember that the corpus luteum was the sac that the ovum or the egg was in prior to ovulation. And now this sac with the trigger of HCG will continue to secrete estrogen and progesterone because now the body realizes it's pregnant. It needs to go up. And it will continue in that way until about 20 weeks, and it peaks around days 50 to, let me just move myself over here. 50 to 70. And let's look at this little chart, and you can see right here where HCG starts at the beginning of the pregnancy, it peaks, and then here's around the 10th week. So a lot of people are really nauseous. This, in combination with the change of hormones, makes them super nauseous. And so you can see now it starts to come down because the placenta is formed. The placenta is formed by the 13th week, which is the end of the first trimester. So you can see how there's that big peak and then it goes down. So HCS is my very favorite hormone. I think it's completely fascinating. It's called human chorionic somatomamotropin. So human, and then chorionic, which would be one of the lining or layers of the placenta, and somatomamotropin would be in relationship to hormones of the breast. It's also called human placental lactogen, which is very similar in wording. So human and then the placenta and then lactogen for the breast. So this hormone is produced solely by the placenta, and it's an insulin antagonist, which is very fascinating. So what it does is it makes mom a little insulin resistant. So what that means is her sugars elevate a little bit so that the baby can get the blood sugar or can get the glucose. Your body thinks it's 500 BC, and in 500 BC we were pretty much eating a paleo diet. We had some fish, some grubs, some, goodness gracious, a buffalo if we were lucky, leaves, green leafy things, if we were very fortunate, a fruit. So it's not like living in 2000 where glucose is abundant and available. So this hormone makes it so that if mom is throwing up, not eating a lot, whatever she does eat, it makes her a little insulin resistant. So insulin resistance means that the glucose cannot go into the cell, and so it stays in the vasculature. When it stays in the vasculature, it goes to the intravillous gap, and the baby gets more glucose, which is awesome, especially in times of when mom is having nausea and vomiting. If mom is anorexic, you see sometimes with moms, they eat very little, have a normal sized baby. Of course, we don't want that. We never want to encourage dieting during pregnancy or withholding food or nutrients, but it's very fascinating how this hormone can help facilitate fetal growth in the presence of very limited food. What is not so great about this hormone? So sadly, America is very overweight, and so when you're overweight, fat put out 3 hormones that cause insulin resistance. So insulin resistance makes your blood sugar go up, and this is why we have so many pre-diabetics and so many diabetics walking around, because they have a higher adipose level, and that adipose is secreting those hormones that make us insulin resistant. So when we talk to people who have pre-diabetic blood sugars, say for instance 100 fasting, we say you need to lose 10 pounds. If you lose 10 pounds, you will lose adipose and fat, and that will lower your insulin resistance. And of course, walking and exercising lowers your insulin resistance as well. So we like that. So anytime we find somebody who's insulin resistant, they're pre-diabetic, or just came into type 2 diabetes, that's our first target. But pregnant ladies, sadly, pregnant ladies are older and they're heavier. And so when you throw so you get mom who comes in there and she's already pre-diabetic. Then you throw a little bit of this hormone on her many times will make her have gestational diabetes because she's already insulin resistant. Now we're making her more insulin resistant and her blood sugar just goes higher. Now, that's one case scenario. We have very thin, fit women who just have a just unbelievable sensitivity to this hormone. So they can come in, everything's normal, everything is fine. They start getting this hormone, they get very insulin resistant. And so that's where your two types of diabetes, and they're all considered gestational diabetics, but it's usually because somebody was already insulin resistant and got some of this, or they were not insulin resistant whatsoever, but they were very sensitive to the hormone. But it allows it to cross. And you can see on this little diagram down here, this little schematic is very fascinating, that it starts here and then the placenta starts taking over around the 13th week. And you can see just how it goes up, 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 up. So during this significant incline right here at 28 weeks, we are going to test her for gestational diabetes to see if this hormone is adversely affecting her. And if it is, then we're going to get her on an action plan so that this baby does not get too big. We don't want the baby to get too big to come out. And also, we know that high blood sugars during pregnancy decrease the amount of surfactant that is made in the infant. So a lot of these babies who come out, 12, 13 pounds, a lot of times they have to go into the NICU because they don't have enough surfactant because their blood sugars were so high that it altered surfactant production. Very fascinating. It also stimulates breast development to prepare for lactation. Estrogen, and we've talked about this one. We love estrogen. Estrogen is great. It stimulates the uterus and provides a suitable environment for the pregnancy. It helps the breast to get ready for breastfeeding. But you can see right here, these are the three estrogens in your body: estradiol, estriol, and estrone. And you can see they just go straight up. And here at delivery, it is the equivalent of 90 birth control pills. So estrogen makes us feel good. Estrogen supports the pregnancy. But elevated estrogen decreases fibrinolysis and increases fibrinogen. So what that is a setup for is a blood clot. So you have to watch these patients, and especially at the time of delivery and after delivery, because these levels are so very high. Relaxin is a true pregnancy hormone, and it is produced by the placenta. And what it does is it makes your ligaments loose. So it decreases uterine activity and the contractions, but it loosens the ligaments. So your pelvis is here, and ligaments are what hold it together. And so when it loosens those ligaments, your pelvis you get a big burst at the end of pregnancy of relaxin, and it allows your pelvis to separate and give the baby just enough extra room to get out. Sadly, relaxin is not specific to your pelvis. Relaxin relaxes all of your ligaments in your body. So your hands, your knees, your shoulders, your hips, your feet. A lot of people will gain a shoe size during pregnancy and never go back because their ligaments were relaxed. That's the only thing that holds your feet together. And then after delivery, there's a remodeling of the collagen and their foot is just a bigger size. So this is why we don't encourage patients to lift over 20 pounds during pregnancy, because they cannot feel this ligament stretching. But in the long run, this is why we don't want any heavy weightlifting during pregnancy. They won't feel the damage during pregnancy or the short term thereafter. But over the course of aging, they will start to feel the loose ligaments, which puts them at risk for ligament tears, loose ligaments, ligament damage. So while we love relaxing during pregnancy, we certainly worry about women lifting too much weight. Prostaglandins are lipid-like substances that are found in the vagina. We do know that we don't know everything about them, but we think that they can start labor. What's interesting is in semen, how you have sperm. Around the head of the sperm are prostaglandins, and those will protect the sperm so they can get into the cervical mucus and they can make their way to Mecca. It's like little helmets that they have on. So they're well protected. So there is thought to say that prostaglandin on the cervix can lead to labor. Progesterone, and remember we talk about progesterone is it starts to elevate in the luteal phase, so after ovulation, and it's super important. It plays the greatest role in maintaining pregnancy. If you have a decrease in prostaglandins, you will lose the pregnancy. So you can see how prostaglandin, it starts out here. And then it just goes straight up as well. And here at delivery, it will fall. There is no risk for prostaglandin falling as far as a clot. That's only estrogen. But it maintains the decidua. If it falls, the decidua is going to slough. And that would be then considered a period, and the mom would lose the pregnancy even early on. It's a smooth muscle relaxant, so the vessels on your body are smooth muscle. So when you start to gain a lot of extra blood volume, the progesterone will allow your vessels to relax so that it can accommodate that 1,500 extra cc's of blood volume, which is fascinating. It also, your belly and gut are smooth muscle, and this is what really goes to that constipation. That in combination with iron and not a lot of fiber and water can make moms really constipated. That's it for hormones. Thank you so much. And if you have any questions, please ask them on the discussion board. Thank you.